One of the specialty hospitals of the Detroit Medical Center, Children's was the first and is currently the only freestanding children's hospital in the state. It treats more children than any other hospital in Michigan. In short, it's a very special place that gives youngsters in need their best possible chance. Meet Michael and Alyssa Dunn of Grand Blanc and their twin daughters Isabella with Dad and Madeline with Mom, born on the 4th of July.
Our little firecrackers.
The girls had a great start, and for their first 2 months, there were no problems at all.
Very happy, healthy little girls.
Eating well.
Sleeping and eating.
It was a chance for 2-year-old Isaiah to get to know his new little sisters. Then, early in September, at their 2-month checkup, everything changed. Isabella seemed okay, but a distended abdomen sent Madeline to a local hospital for an MRI.
They came into the room late that night to let us know that it was neuroblastoma, a type of cancer that she did have in her abdomen. There was a tumor the size of a softball, as well as her liver was filled with the cancer cells and her bone marrow.
And so the nightmare had begun. The cancer had started most likely in the womb and was growing so fast that the hospital wanted to move quickly with surgery.
So we met with the surgeon that night and we signed papers to have the biopsy taken and the port put in the next day.
But overnight, the Dunns were filled with second thoughts, and staffers at their local hospital strongly urged them to move Madeline to Children's Hospital of Michigan.
They said, "You really need to be there, and if we made it easy, would you go?" And we said, okay.
From the very second we checked in and the nurses started taking vitals and things, they were so caring. They just could tell that they really cared for the girls. Everybody was so nice.
Dr. Jeffrey Taub, a pediatric oncologist at Children's, has vast experience in the field and a kind of personal stake. As a teenager, he was treated for cancer at Children's. Because Madeline's abdomen was so distended, the doctor felt surgery at this point was too risky.
Because theoretically, if you do a big abdominal incision, because their abdomens are so distended, you may not be able to close the incision right away.
So if the Dunns had stayed at their local hospital for surgery,
she wouldn't be with us.
Just clear that things would have been very different.
In the meantime, little Isabella began showing the same symptoms that her sister had and was also placed in the neonatal intensive care unit.
And that night we found out she too had this type of cancer. So we went from having one sick child to 2 sick children within a couple hours.
Dr. Taub quickly started both girls on chemotherapy for 2 days before doing a biopsy on their livers and checking their bone marrow. The tests confirmed the cancer called neuroblastoma.
Both girls had it, and the bone marrow biopsy confirmed that there was cancer cells in their bone marrow.
Fortunately, says Dr. Taub, in children this young, this type of cancer is often treatable.
As long as we're aggressive, it can respond to chemotherapy, and sometimes once we control the growth of the tumor, some of it can actually die off on its own. So as long as we sort of institute treatment very rapidly and stabilize the child, they actually have a fairly good prognosis.
Nonetheless, there was clearly a long struggle ahead.
While you wait for the chemotherapy to take effect, the children quite often get much more sick in terms of needing to be on a ventilator to help with their breathing if the tumor from the liver is pressing on their lungs.
The battle to save the little girls went on for 44 days at Children's, through 2 rounds of chemo.
I mean, the nurses had so much compassion, and the doctors, and they would cry with us when we were hurting, and they would smile when the girls were doing good.
Finally, after 3 weeks, after their second round of chemo, the baby started to show real improvement.
You look so much better.
They had not really seen each other since they got sick, and their reunion was something special.
It was clear when we put the girls together, they just lit right up. You could see it on their faces. I wouldn't have believed it if I hadn't seen it myself. They honestly lit right up as soon as they saw each other. And we put them together and they were just smiling at each other and cooing at each other, and they never were separated since then.
They came through the second round of chemo very well, and after 6 tough weeks, the girls went home with their grateful parents.
We can't say enough about the doctors and the nurses at Children's. They just were amazing. They were very caring and attentive.
Sarah, smile.
Dr. Taub saw them again earlier this month, just prior to their third round of chemo.
And they both look very well. They're feeding much better than when they were in the hospital. They're sleeping well. They're very interactive. They're happy. They smile. They're very alert. They follow things very well. So from that standpoint, they have been stabilized. We still have tumor that we still have to treat, but fortunately we've had things under control, whereas before it was out of control.
After their fourth round of chemo in late November, the girls will go through new testing that will set their future course of treatment at Children.
They don't really give us a prognosis, but they're very optimistic. They seem very confident that this is something we can beat, that the girls can get over this.